Beautiful morning to all of you, my guys. I welcome you back to my YouTube channel once again. My name is Mati Danjuma from the Faculty of Veterinary Medicine, Ahmadu Bello University, Zaria of Nigeria. In this video, I'm going to be introducing to you guys how veterinary anatomy is all about, or how anatomy as a course is all about. Just a little bit introduction. So it will not take your time. You can just, if this is your first time of watching this video, I would like you or ask of your help to please subscribe to this channel and hit the notification bell to get notified anytime I drop a new video. Because in this video you are going to take advantage. You will know more about anatomy. You will understand the basics of anatomy, mostly veterinary anatomy. Many people have come across see that what is veterinarian study bones? What do they know about bones? See bones here, see bones, see bones. You two are made of bones. So in this video, I'm going to give you an introduction that will help you or guide you to know more about veterinary anatomy. You know, our veterinary anatomy is such a different anatomy. It's not unlike other anatomies. This one in veterinary anatomy, you see different species like this anatomy. This is of the horse. This the horse you can see. Some people are here. Then some other species are also involved here. So in this video, we are going to introduce to you more about veterinary anatomy.
Today we will be talking about anatomy. I think this is the best video. We'll be starting with the definition and we'll do some little deep into anatomy. First we will start with the definition of anatomy. Anatomy is the study of forms and structures. Forms in the sense that what forms that structure and the way the structures are, mostly in living organisms. This is anatomy of animals will be precisely studied. And in anatomy, there's what we call surgery. You cut parts of the animals that are defective or have disease or are infected. In the sense that anatomy is like studying of the normal structures and forms, while pathology is studying the defective or infected structures. And in anatomy, there are divisions of anatomy. Anatomy have subdisciplines. Which one we have microscopic anatomy or histology. That's when we study tissues and cells. Another one is embryology, or developmental anatomy. That's when we study the development of fetus or infants from zygote, from the two gamete cells uniting to become zygote, from zygote to embryo, from embryo to fetus, up till birth. Then another one is ontogeny. Ontogeny is the study of the entire development of an individual. That is both from from birth up to when the person is old. And we also have phylogeny or ancestral history. It's the study of evolutionary changes undergone by species indicated by geological evidence. That is, there are certain things, maybe bones or traces of those their ancestors, where they lived and how those ancestors turned to the normal organisms that we have these days. Okay, we have another one which is comparative anatomy, where you study one animal and compare it with the other. because in the animal kingdom we have different species, different phylums, different orders, different classes. So you now pick a species, you study it and compare it to the other. What makes the difference? What do they have in equal? Do they have the same? That's for the comparative anatomy. Then we have structural cytology, that's the study of cells. You study cells, like let's say for the liver, the cells are different from the kidney, the heart, all of them have different cells. So that's where you use to study the cells. You have veterinary anatomy. Mostly in veterinary anatomy, we study domesticated animals. We study domesticated and now we have the special anatomy. That's where you pick a species, you study it, you specialize on that species. Then methods of approach. How do you approach the study of anatomy? You have 3 methods. First, you can start with going system by system, that's systemic approach. You can pick first this osteology, that's the skeletal system. You pick the syndesmology, that's study of joints. You pick myology, study of muscles. You pick angiology or cardiovascular system, that's where you study the heart, blood vessels. You pick neurology, that's where you talk about the nervous system. Then that is for systemic approach. Then if you go to regional, topographic or regional approach, that's where maybe you cut the head, then you study everything in the head. You cut the limbs, that's the legs or the hands, then you study it. Then for the applied, that's what you do in higher classes. That's when you now apply that in surgery. Maybe an animal has fracture or something, a damaged structure or organ. That's where you use that's when you now use radiograph to view structures, that damaged structures or the ones that are not in the right places they are supposed to be. That is the last approach. Then we have the topographic terms that we use in describing anatomy. If first we have ventral, if you hear anything ventral, let's talk more than that. If we talk about ventral, it has to be lower, the part that's facing the ground or downward. That's what we mean by ventral. Like for instance, this place is ventral to this place. That's what we mean by ventral. Something below or towards the ground. Then if we say cranial, you know the brain is covered by the skull, which is also known as the cranium. And if we say something cranial, that's towards the head side. That's if you hear cranial, maybe towards the head side. Then if you hear median or mid-sagittal plane, that's towards the middle. If you divide the animal into 2 bilateral halves, that's when you get the mid-sagittal or median. Then sagittal plane, it can be a cut, but it mustn't be between 2 the same bilateral halves, but it can be just a cut, an imaginary cut from somewhere else. Then if we talk about transverse, this is longitudinal. If you transverse a line, that is you cut 90 degrees to the longitudinal line, that's when we call transverse. Like this rib is transverse to these vertebral bodies. So that's what we mean by transverse. Then lateral, if we talk about lateral, it's away from the body. Let's say this is the mid-sagittal plane. Then away from that mid-sagittal plane, that's where we call lateral. Then medial is towards the body or towards that mid-sagittal plane. That's what we mean by medial. inferior. Then if you talk about distal, this has to do with the limbs, mostly the limbs. Distal is downward, like just ventral, but this one is specialized for limbs. Then proximal is upward, like above, then below. Sometimes they can exchange those words with superior and inferior. Superior means proximal, inferior, distal. Then we have dorsal and palmar. Dorsal is used for top, like just proximal, but not maybe in the manus or pes. That's where you can find that when it's on the metacarpus or towards the forearm, at the tail forearm. This place, the palm, that's where we call palmar. Then on top of the palm, that's where we call dorsal. Then for the hind limb, that's for the forelimb. For the hind limb, it is called dorsal and plantar. For forelimb is dorsal and palmar. Then we now have on the head. Normally, the way we say cranial, if to the tail, we call it caudal. Towards the tail, it's called caudal. Towards the head, it's called cranial. And when you reach the skull, you not still call it cranial again. You call it rostral and caudal. If it's towards the nose or the mouth, you call it rostral. That's towards the tip of the head. Then backward, you call it caudal.
Continue.
Okay. The girdle is just something that attach the appendages to the main body of the animal. And here we have the arm, that's where we have the humerus. Then here we have the forearm, that's where we have the radius and ulnar. Then we have the manus, where we have the carpals, metacarpals, and phalanges, digits, phalanges that make up the digits. Then for the hind limb, we have 3 bones that form the pelvic girdle, which is the ilium, ischium, and pubis. Those 3 bones form the pelvis, form a complete structure called pelvis or ox coxae, or oxa coxarum, for the 2 parts, because they are bilaterally symmetrical. Then here we have the thigh, where we have the femur. Then we go to the pes, where we have the tibia and fibula. Then we will go to the cross, where we have the tarsus, metatarsus, and digits.
So thank you for watching the video. Thank you for watching the video. I will be dropping a link to another video that will link you to more about veterinary anatomy. Please, let's meet. You can ask your question in the comment section. I will also be dropping the link in the comment section to guide you more, or to tell you more about some of my videos that I will be dropping. So thank you. Please try and subscribe to this channel, so that you can hit the notification bell to get notified anytime I drop a new video.